Hello, everyone. I'm so pleased to welcome Dr. Terri Armstrong, Senior Investigator and Deputy Chief of the Neuro-Oncology Branch of the NIH, and Dr. Mark Gilbert, Senior Investigator and Branch Chief of the Neuro-Oncology Branch. Now, as an overview, the Neuro-Oncology Branch is a trans-institutional initiative launched in 2000. It's sponsored by both the National Cancer Institute and the National Institute of Neurological Disorders and Stroke, NINDS. The Neuro-Oncology Branch conducts both clinical and laboratory research, and its mission is to develop novel diagnostic and therapeutic agents for patients with primary central nervous system tumors, CNS tumors. The NOB, or Neuro-Oncology Branch, sees patients in the brain tumor clinic and is an excellent option for patients to receive a free second opinion. In fact, this is one of the best kept secrets in the brain tumor world, and we hope that everyone knows about the Neuro-Oncology Branch. We welcome and thank Dr. Mark Gilbert and Dr. Terri Armstrong for joining us here today as we inaugurate the first Glioblastoma Awareness Day. Thank you, Mark and Terri.
Thank you, David.
Thanks, David. It's great to be here to talk to you.
So why don't we get started on this inaugural GBM Awareness Day, where we're trying to honor and act. We're trying to inspire all Americans to come to understand GBM, understand their stake in this disease, and to take action to ultimately conquer and cure GBM and other brain tumors once and for all. What's your answer to the question of why every American should care about GBM?
Yeah, so glioblastoma is a tumor that does not discriminate. It affects all races, ethnicities, and all age groups. It's one of the most malignant tumors that has been identified, and unfortunately has an impact not only on the person, but the family as well. There's been a lot of limitations in terms of our ability to treat it that maybe Mark can share.
Sure. So one of the great difficulties with glioblastoma is that it's a very infiltrative cancer, which means the cancer cells can grow into the brain, making surgery to remove all the cancer impossible. So even though neurosurgeons do a spectacular job of removing these cancers, they can only remove the cancer that they can see.
What is the current state of GBM research and clinical care, and how does that compare to advancements in treating other cancers?
So it's a great question. As many people know, there have been tremendous advances in the last 5 to 6 years, many of them focused around immunotherapy. But in cancer in general, our ability to do very sophisticated genetic analyses of cancer cells has provided us tremendous insights. And I think the challenge in glioblastoma is to translate those insights into effective clinical trials. What I'm very encouraged by is that this technology is being increasingly utilized. And in the field itself, we are taking this knowledge and we are collaborating in efforts to bring this fantastic laboratory knowledge into clinical trials. So the state-of-the-art clinical trials in glioblastoma and other brain tumors are now reflecting more and more the increasing knowledge we have about the disease and its biology.
So I'd probably add to that with a couple of points. One is glioblastoma is a relatively rare cancer when you think about it and compared to other cancers like breast, lung, or colon cancer, representing only about 2% of all cancers. So what that means for an individual diagnosed is they oftentimes learn they have this tumor after presenting suddenly with a symptom, going to the emergency room and being thrust into this world of having a brain tumor. And oftentimes they can be surrounded by healthcare professionals who maybe have never seen somebody with a brain tumor before, or maybe only a handful of people. So there's a lot of need for knowledge and education that maybe isn't where some of it is for other cancers that maybe are more common. The other thing is there's some great advances in treatment and clinical care in other cancers. We know that there's benefit of immunotherapy in some of these other cancers, and we haven't yet been able to see that benefit in glioblastoma. But because of clinical trials that are currently ongoing, we're hopeful that there will be evidence of effect in the future.
Well, let me add to that one of the challenges we have, and I think Terri very succinctly pointed out, that it is a rare disease. And then when you look at the data that shows that approximately 5% of patients with glioblastoma actually participate in clinical trials, it makes it even more challenging. So I encourage people who are diagnosed with glioblastoma and other brain tumors to seek out consultation in centers of excellence and to seriously consider participating in clinical trials, because that's where the advances will occur.
Great point.
Thank you. And a related question is, while some glioblastomas start as a glioblastoma, isn't it true that some types of brain tumors start as a different type of malignant brain cancer and then can evolve into a glioblastoma? So for those that may have not have a glioblastoma today, but have a different type of brain tumor, what's their stake in fighting GBM?
So I think they have a tremendous stake, because these cancers, which we call lower grade glioma, so glioblastoma is a type of glioma, these lower grade gliomas very, very commonly over time transform to glioblastoma. And so I think all people with primary brain tumor, but particularly those with lower grade glioma, have a great stake in us understanding the mechanism by which their low grade cancer becomes a high grade cancer. Then we will have opportunity, hopefully, to prevent that transformation.
And that really transitions to our next question, which is, where are we at the forefront of brain tumor research? And what opportunities are there to move the needle and bend that survival curve? There's, of course, many different types of brain tumor research ongoing, but what's at the forefront of progress, and where are things going?
Well, I think things are going in a positive direction, and I think that there are a lot of dedicated investigators, researchers in the field who are tremendously clever and creative. I think there are two major areas. One is immunotherapy, and this is following the great success in other cancers. To date, there have been limitations in immunotherapy, and I think part of that is a lack of understanding of all the nuances of the immunologic response in brain tumors and understanding better the patient's ability to respond. But the other area is the molecular characterization of the cancers, looking for specific targets within those cancers. So applying what we call precision medicine, recognizing that each patient's cancer is unique and finding the targets within their cancer that are suitable for treatment. With recent investigation, particularly what we call single cell tumor analysis, we're finding that these cancers are within themselves quite different from cell to cell. And that's a really important recognition, because it tells us that our targeted therapies have to be very, very well selected and designed. And all of that leads to really the bottom line, which is developing very innovative clinical trials to test all of these approaches as quickly, as efficiently, and as accurately as possible. And that gets back to the increasing international collaboration and the increasing requirement for engagement and participation by patients.
Thank you. And just shifting from research to clinical care, what's at the forefront of clinical and medical care for GBM patients? As we all know, patients want to survive, but while they're surviving and living, they would like to have a better quality of life and want better health care. What's at the forefront of GBM care?
I think that's a great question. We know that glioblastoma impacts most folks from the time of diagnosis. Studies have shown that between 80 to 90% of folks have symptoms that prevent them from going to work from that time of diagnosis. So we're increasingly recognizing the importance of managing those symptoms and improving functional status. So that means expanding the care providers who provide care to these patients, exploring the use of physical therapy and rehabilitative therapy, cognitive therapy to help improve their care as well. Probably this patient population, more than any other that I've been able to take care of, it's really a disease that involvement of the family and inclusion of the caregiver in that equation is really important. A lot of times there's changes in roles, difficulty in understanding the process. So care is really focused now on caring for both the patient and the family as a unit. So that family-focused care, I think, is an advance in neuro-oncology that I think will improve not only the length of life, but the life quality of patients.
Thank you. You know, just thinking out 5 years from now, where would you like to see the trajectory of glioblastoma research and a reduction in the burden of GBM 5 years from now, hopefully different from it is today? What's your vision?
So my vision would see increased awareness of the issues, and events like the GBM Awareness Day is perfect for that. And having patients and family members, when a diagnosis is likely, so somebody arrives in an emergency room with symptoms, an imaging study is done, they see a mass, a thoughtful decision is made about where best to have that evaluated. And I would advocate that centers of excellence where the neurosurgical staff are experts in management of brain tumors is a great start. That means that the best operations will be done. That means the best tumor tissue acquisition for all of the advanced studies, which allow us to do and consider personalized medicine. Those investigations will not only look at targeting the tumor, but the immune system. So it all starts from the beginning. So if we can get the patient on the right path, there is even now clear evidence that those patients do better. And the more we can do that, the more we will alter the survival curve, we will improve the patient's outcomes, and I would argue the quality of life, because the level of care would be advanced. While we're doing that and having more patients engaged in the research environment, it will accelerate the progress of the clinical research, the clinical trials. It allows us to develop new tools. There's been a lot of discussion about liquid biopsy, and we now know that the cerebral spinal fluid that surrounds the brain is probably a pretty good place to look, relatively non-invasively. Getting some cerebral spinal fluid and evaluating the laboratory may give us insights into the tumor biology and maybe early signs of tumor progression before we see any changes on imaging. Imaging studies are advancing. We're now doing highly sophisticated studies looking at cancer metabolism that we've never been able to do before. All of this is going to come together, I think, very rapidly. The progress, the speed of advancement is unprecedented. So if we can get everybody collaborating together, laboratory investigators, clinical investigators, care providers, patients, and their caregivers, all working together, of course, with groups like your group, NBTS, I think we can make significant advances in the next 5 years. The conversation that we would have at the Awareness Day in 5 years, I think, will be a very different dialogue.
Thank you. Our last question is for both of you, and it's, on this Glioblastoma Awareness Day, what actions would you like to see across our country towards conquering and curing brain tumors once and for all? And specifically, what would you like to see individual philanthropists and those who are willing to give do for GBM? What would you like to see the government do? What would you like to see the private sector do?
Well, I think everybody is needed in this equation. All stakeholders have to come together. It's only through research that we can advance the care and the treatment of patients. And I think all the groups that you mentioned need to be able to support that in the ways that they can. It's only through that partnership that we can make a difference. That means improving laws so patients have access to treatment, so drugs can be approved quickly for patients, and we have the supportive care covered for patients who are having issues related to their tumor. But everything focuses on advancement through clinical trials and support for research.
I would echo that 100%. I think we don't want to hear about patients who are motivated and engaged not being able to get access to state-of-the-art treatment because of financial issues. Similarly, I don't want to see really creative research not being able to be funded because the allocation of funding doesn't recognize the importance of glioblastoma. If you look at it statistically, brain tumors are 2% of cancer, as Terri mentioned before, but their impact, both locally and globally, is much greater than that. And it's an unmet need. It is a disease where we need to make significant advances, and we can only do that if we have a critical mass of investigation and patient support and financial support.
Well, Dr. Armstrong, Dr. Gilbert, on behalf of National Brain Tumor Society, we're grateful for your participation in this today. And thank you so much for all you're doing to advance research, patient care, and to join us in this inaugural GBM Awareness Day. Thank you.